Hello, my name is Frankie, and today I'm going to be doing a spine and hip evaluation on my patient here. Hi, what's your name?
It's Margaret.
Nice to meet you.
Nice to meet you.
So what's going on today, Margaret?
I just came in because my leg's been a little bit weird.
So tell me what happened.
So we had a game yesterday, and I was going for the ball, and the ball was like right out in front of me, and so I stepped with my left foot, and I just kind of felt like something not right in my right leg, and so I just played through it. It seemed fine, but now it just doesn't feel good. So I just came in to see
Okay.
what you can say.
Did you feel any sharp pain, or was it throbbing, or was it dull?
I'd say it was sharp.
Okay.
Sharp
On
pain.
a scale of 1 to 10, 10 being you have to go to the hospital, what kind of pain was it?
I mean, at first when I did it, it didn't really bug me. It was like a 3, I'd say, just because I was just playing through it. But then after the game ended, it was just like annoying. It felt like it was like a 5 or a 6, I'd say. So,
Okay. So it got worse.
yeah.
Okay. Did you do anything for it, like ice or take medicine?
No. I just thought it would just go away, and so I just dealt with it. But today it's doesn't feel right.
Okay. So this happened when?
Yesterday.
Yesterday?
Mhm.
Okay. During a game?
Mhm.
Okay. Have you gotten hurt like that before?
I've not.
No?
No.
Have you had any injuries to your lower body?
No, not that I remember.
No? Okay. Is there any position that makes it worse for you? Like walking or sitting or standing?
Yeah, walking after the game just was really painful for me. Usually like me getting up, like having to like use this leg to get up, like to stand up, hurts a lot as well. Stuff like that.
Okay. Is there any position that alleviates your pain?
I mean, like sitting like this is fine, but I mean, just with this leg, it's just any kind of like
When
walking.
you
I do
move
with
it like this?
Yeah.
Okay. Sounds good. Are you college player?
Yeah, in college.
College player, okay. So no previous injuries, anything like that? Okay,
No.
good. So if I have your permission, if I can do some tests on you and
Yeah.
feel around and see what's going on, is that okay?
Yeah, that's okay.
Okay. So I'm gonna have your legs over here and then your head over there.
Okay.
Can you do that for me?
Yeah.
Thank you. Alright, so palpate. So you have any pain over here?
No.
No. So bilaterally palpating. I'm doing his good leg first. Any pain up here on your ASIS?
No.
No. Here on the crest? No. Down here? No pain? Okay, good. What about on here? On your bad side? Any pain?
Yeah, right there.
Right there?
Yeah.
Okay. Where, if you could point to one spot, where would it be?
It's like right here.
There? Okay.
Yeah.
Do you feel like it's deep or is it like up in the front?
Kind of feels in the front.
In the front?
Yeah.
Okay. Any pain out here?
No.
No. Any pain when I'm in a squeeze?
Not really, no.
No? Okay, good. So pain?
Yeah.
A little bit?
Yeah.
Okay. Alright. So I'm gonna have you bring your knee to your chest,
Okay.
and I want to test to see if if you have any pain with that.
Okay.
So go ahead and bring this leg to your chest, and then stop when you feel pain. You feel pain there?
Kind of just, I don't know, it just feels different than my other leg.
Yeah? Okay. Now, do your good leg. Okay, good. So now, I had him do active range of motion. Now I'm going to be doing passive range of motion. I'm gonna do his good leg first. Any pain?
No.
No? Good. Pain? Tell me when you feel pain.
Yeah, a little bit.
There?
A little bit.
Okay. Now, bring your leg out for me to the side, like this. Pain?
No.
No?
No.
Okay, good. Now bring it straight up. Yep. Pain?
A little bit.
A little bit? Okay, good. Relax. So I'd be checking range of motion bilaterally, but for the sake of time, I'm just doing his good leg while testing for abduction and hip flexion. Pain?
No.
And weakness? No. Okay. Pain or weakness? Tell me when. Right there?
Feels kind of weak right there.
Okay.
A little bit weak.
So I'm gonna have you flip over onto your back.
Okay.
Yeah.
On stomach, you mean?
On your stomach, sorry. So I'm now gonna be performing. It was on this side, right?
Yeah.
Yeah, it was on your right side.
Mm-hmm.
And then any pain?
No.
So I'm performing an Eli's test. No?
Not really, no.
No? Okay. So this checks for hip tightness. So what if I do this?
Yeah.
Yeah?
Yeah.
Okay. Now if I can have you, I'm going to be performing manual muscle tests. I'm going to be testing hip flexion, hamstrings, hip extension. So what I want you to do is bring this leg up to the ceiling for me and stop when you feel pain. Feel pain?
Yeah.
Yeah? Okay. So now I'm gonna apply resistance downwards, and you're gonna hold this position. Don't let me break you.
Okay.
Ready, go. Pain?
Yeah.
Weakness? Yeah.
Just pain.
Just pain? Okay. Good. So now I'm gonna have you stand up for me. Stand like this for me.
Like right here?
Right here. So you're gonna bring this leg back, slightly bend this leg, and bring this leg back. Okay, good. So I want you to hold this position, and don't let me push you down. Okay.
Okay.
Square you up a little bit. Ready, go. Pain,
Yeah.
weakness.
Little
Yeah.
pain. Yeah.
A little bit of pain.
Yeah.
Seem a little weak as well. Okay. So now I'm gonna have you sit down for me.
Okay.
So now I'm gonna be, actually, I'm gonna have you lay down one more time. Sorry. So what I'm gonna have you do, and put his leg in external rotation, abduction, and flexion. So I want you to hold this position.
Okay.
Alright. Don't let me break you. And then tell me if you feel pain. Ready, go.
Yeah.
Yeah?
Yeah.
Feeling a little weak too?
Mhm.
Yeah. Okay, good. Now if you can sit up for me. I would be testing both for bilaterally, but for the sake of time, I'm just going to be testing his affected leg. So now I'm going to have you, I'm going to do a manual muscle test, testing your hip flexors.
Mhm.
That previous test was testing the iliopsoas, so that muscle by itself.
Yeah.
But now I'm testing the rest of your hip flexors.
Mhm.
So I'm gonna support here. So I want you to bring this up to your knee up to your chest. Thank you. Any pain?
A little bit, yeah.
Yeah. Okay. So I want you to hold this position for me.
Okay.
Don't let me break you. Okay. Ready?
Yeah.
Yeah. Pain
Yeah.
and weakness.
Mm-hmm.
Let me test this like really quick to compare. Bring that up. Any pain or weakness?
No.
Okay, good. Now hold this for me. Okay, good. So, Margaret was able to hold her left leg against my resistance. So that was, she had a full strength, so that was a 5. And then compared to her left leg, or to her right leg, she was struggling a bit against my resistance. So, but she was able to perform the motion and hold her leg in the hip and her hip in the flexed position. So that was at least a 3, but I would give her a 4 because she was struggling with a little bit of resistance. So for that manual muscle test, I would give her a 4, and the same for her sartorius, because she was able to hold the position, but not at full strength against my resistance. Did you have, was there anything wrong with your posture or the way you're walking after? Did you have was there any deviations there?
Not really. It's just that like walking on this leg hurt more, so I was kind of maybe like going towards this leg maybe more because just the pain.
Okay.
So, I mean, if that would be anything, but
Okay. So what I've collected so far, it seems like Margaret has a hip flexor strain. Maybe more specifically her iliopsoas strain, grade 1 strain of her iliopsoas, because of the positive manual muscle tests and Eli's test. She had quite a bit of hip tightness. You didn't hear a pop or anything like that, right?
no.
Or a snap?
I mean, it kind of felt like a how to describe it.
You feel like a tear?
Yeah, a little bit. Like
Like-
kind of like a rubber band, maybe kind
Okay.
of thing.
Okay.
It just felt weird. I don't know what to describe it as.
Okay. So that seems about right for a muscle strain. They just feel the muscle tear, and so that's what she's feeling in her leg, and her manual muscle test came back positive as well. So it makes me believe that she has a grade 1 muscle strain. So for treatment, I would have you ice right away and rest for a few days.
Mm-hmm.
So ice and rest, limit activity, any kicking or any motion that makes it hurt,
Okay.
any flexing of the hip,
Okay.
and then start with E-stem and ice for pain relief. If she's feeling pain right away, she can take anti-inflammatories, and then to get some blood flow going back, we can heat within a few days, and she can stretch and do some myofascial release with foam rolling. I can also ultrasound for tissue healing, to heal that torn muscle. I can also do cupping to get some blood back into the system, and some strengthening. But right now, for the next few days, I want you to rest, ice, and avoid any flexion activities that make this motion hurt.
Mm-hmm.
So just some ice and rest, and then we can start your treatments with everything I was listing
Okay.
right after.